Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Welcome back to the deep dive. Today we're looking at a stack of research that is, I think, arguably one of the most significant public health analyses to come out in the last decade.
It really redraws the map on this entire topic.
It just appeared this week, February 2026, in the journal Nature Medicine. And it fundamentally changes how we have to think about a disease that, it touches almost every single family.
It does.
To get us started, I want to begin with a number. And it's a number that's frankly a little difficult to process just because of the scale. 7.1 million.
Mm-hmm.
That is the number of new cancer cases diagnosed in 2022 alone. That, according to this massive study from the International Agency for Research on Cancer and the WHO, were potentially preventable.
And that's the key phrase right there,
Yep.
potentially preventable. We're not talking about the total number of cancers.
No.
We're talking about this specific slice of cases that they didn't have to happen. These weren't, random genetic mutations or just bad luck in the cellular lottery. These 7.1 million cases, that's almost 40% of the global total.
Mm.
They were driven by factors we can identify, that we can measure, and at least in theory, eliminate.
4 out of every 10 diagnoses. It forces you to confront this really uncomfortable reality, doesn't it?
It does.
We tend to view cancer as this lightning strike, something that happens to us. But what this data is suggesting is that for a huge portion of the population, the call is coming from inside the house.
Mm-hmm.
It's coming from the air we breathe, the things we eat and drink, the habits we keep, and even the places we work.
It really shifts the whole narrative from bad luck to missed opportunity. I mean, if 40% of the burden is preventable, then that means 40% of the suffering is, unnecessary.
So the mission of this study, and our mission for this deep dive, is to move past that generic advice we all know. Eat your vegetables.
Right, don't smoke?
Yeah.
We've heard it.
Exactly. And instead, to actually quantify with hard data from 185 countries what specific risk factors are driving these numbers and where in the world they're hitting the hardest.
And we are going to get into the specific biological mechanisms. How does a drink or, a common virus actually become a tumor?
And there's a massive gender divide in the data that I found genuinely shocking. Plus, we're going to unpack this idea of the latency period, which sort of explains why the choices of the past are really haunting the present.
And we absolutely have to look at the blind spots, because as amazing as this study is, the authors are very clear that 7.1 million is probably a conservative number.
The reality is likely worse.
It is.
Okay, so let's start with the methodology. Because whenever I see a big headline like X% of cancer is preventable, I immediately get a little skeptical.
Of course.
How can they possibly know that? This thing covers 185 countries. I mean, from high-tech health systems in, say, Scandinavia to rural parts of sub-Saharan Africa. That sounds like a complete data nightmare.
It's a monumental epidemiological task, there's no question. The researchers looked at 36 different kinds of cancer and 30 specific modifiable risk factors.
30.
But I think the real genius of the study, and what gives it its scientific credibility, is how they dealt with the concept of time.
Ah, you're talking about the time lag.
Precisely.
Yeah.
You see, cancer isn't a car crash.
Yeah.
It doesn't happen the second you do something risky.
Right.
If you smoke a cigarette today or get a really bad sunburn this afternoon, you don't wake up with a tumor tomorrow. There's this biological delay. It's called the latency period.
It takes time for the damage to actually build up.
It takes a lot of time. Time for a carcinogen to corrupt a cell's DNA, for that cell to somehow avoid the immune system, and then for it to replicate enough times to become a detectable mass.
So if they're analyzing cancer cases from 2022, which is the focus year, looking at risk factor data from 2022 would be, useless.
It would be completely irrelevant. The things people did in 2022 haven't caused cancer yet. They'll cause the cancers of the 2030s. So to understand the 7.1 million cases from 2022, the researchers basically had to build a kind of statistical time machine. They used risk factor data, smoking rates, pollution levels, obesity rates from about 10 years prior, so roughly 2012.
That's a fascinating way to frame it. So the 7.1 million tragedies we're discussing today are, in essence, a time capsule. They're the direct consequences of the policies we lived with and the choices we all made a decade ago, finally coming home to roost.
And to put a number on that, they used a metric. It's called the population attributable fraction. It sounds dense, but the idea is actually pretty simple.
Okay, break it down for us.
Imagine two parallel worlds. In world A, Our reality, people smoke, they drink, they breathe polluted air. In world B, a sort of clean, theoretical world, nobody does any of those things.
And the population attributable fraction is just the difference in cancer cases between those two worlds.
Exactly. It calculates how many cases would just disappear if we lived in world B. So if the fraction for, say, lung cancer and smoking is 80%, it means in a world without any tobacco, 80% of lung cancer cases would just vanish.
Wow.
It lets us put a hard number on what preventable really means.
And they applied this logic across 4 specific categories or buckets of risk. We have behavioral, environmental, occupational, and infections.
That's right.
So let's drill down into the findings, because there is a very clear hierarchy of destruction here. In this global look at 2022, what floated to the top?
There are 3 main culprits that stand out far above everything else. And the first one is, well, it's frustratingly familiar. Despite decades of public health campaigns, the undisputed king of risks is still tobacco.
We all know it's bad, but what did this new analysis find? Just how bad is it?
Tobacco is responsible for 15.1% of all new cancer cases worldwide.
15%.
That's 3.3 million people in a single year. And we have to correct a common misunderstanding here.
Okay.
We often think, I smoke, I damage my lungs. But tobacco smoke isn't a local problem. It's a systemic poison.
It doesn't just stay in your chest.
Not at all. When you inhale, you're taking in this cocktail of carcinogens. I mean, benzene, polonium-210, nitrosamine.
Nasty stuff.
And these chemicals cross from the lungs directly into the bloodstream. And once they're in the blood, they get pumped to every single organ in your body. This study links tobacco to 15 different types of cancer.
15?
Yes. The bladder, the kidneys, the pancreas, the stomach, the throat. It goes on.
So you're basically bathing your entire cellular system in toxins.
You're creating a state of chronic inflammation and DNA damage everywhere the blood flows. That's how one consumer product can be responsible for 15% of the world's cancer burden.
So tobacco is the clear, if tragic, leader. What's number 2? This is the one I think will surprise a lot of people.
It's not alcohol, and it's not obesity.
Yeah.
Not yet, anyway. The second leading cause of preventable cancer in the world is infections.
This is where I think the average person's understanding of cancer really starts to break down. We see it as this, structural failure of the body or something caused by chemicals. We don't think of it as something you can catch.
But in a way, you do. Or at least you catch the biological agent that then drives the cancer. The study found that infections are responsible for 10.2% of all new cancer cases.
10%? How many people is that?
Over 2.2 million.
And what infections are we talking about here? Are these like rare tropical diseases?
No, not at all. They're incredibly common pathogens. The biggest driver by far is a bacteria called Helicobacter pylori, or H. pylori.
I've heard of that, but in the context of stomach ulcers?
It's the primary cause of ulcers, yes, but it's also the primary driver of stomach cancer. The mechanism is just chronic, long-term inflammation.
So the bacteria just irritates the stomach lining for years and years.
For decades. And that constant cycle of damage and repair forces the cells to divide more rapidly, which just increases the chance of DNA copying error. And eventually, you get a tumor.
And what are the other big ones in that infection category?
Human papillomavirus, HPV. It's the overwhelming cause of cervical cancer, and it's also increasingly driving head and neck cancers.
Right.
And then you have hepatitis B and hepatitis C, which of course attack the liver. Over many years, the viral damage leads to cirrhosis and eventually to liver cancer.
The tragedy here feels different from tobacco. Tobacco is a product someone chooses to buy. These are germs, but we have weapons against them, don't we?
And that's what makes the preventable label so incredibly poignant here. We have a highly effective vaccine for HPV. We have a vaccine for hepatitis B. We have cheap, effective antibiotics that can clear an H. pylori infection.
So when we see 2.2 million cancer cases driven by infections, what we're really seeing is a failure of public health access.
That's exactly.
Yeah.
If we had universal vaccination and, frankly, better sanitation to prevent the spread of these bugs, that 10.2% figure would just plummet.
We're not waiting on a miracle cure.
No. We're waiting for better distribution of tools we already have, like syringes and clean water.
Okay, so we have tobacco at number 1, infections at number 2. What gets the bronze medal in this grim competition?
Alcohol.
This is the one that makes people uncomfortable.
It really does. Alcohol is responsible for about 3.2% of all new cases, which is around 700,000 diagnoses a year.
And unlike smoking, where the message is a very hard don't do it, the message on alcohol has always been culturally murky.
Very murky. We hear about moderation or some study about red wine and heart health, But from a pure cancer perspective, the data is it's unforgiving.
How does it actually cause the damage? With smoke, you can visualize the tar. What's a glass of wine doing?
So when you drink ethanol, your body has to metabolize it. And the very first byproduct of that breakdown is a chemical called acetaldehyde.
Acetaldehyde.
And acetaldehyde is a known carcinogen. It's toxic. It directly damages your DNA, and it prevents your cells from repairing that damage.
So it's a double whammy. It breaks your DNA and then hides the toolbox you need to fix it.
That's a perfect way to visualize it. It's a two-pronged attack on the cell's integrity. And this study links alcohol to cancers of the esophagus, the liver, the colon, and importantly, the breast.
The breast.
Yes. For breast cancer, the risk starts to increase even at what we would consider pretty low levels of consumption.
So if we're being purely scientific about it, the only safe amount of alcohol for cancer prevention is 0.
Biologically, yes. Now, socially, that's a different calculation everyone makes for themselves, but we can't pretend the risk isn't there.
And we have to mention metabolic factors, right? Specifically, high body mass index, or BMI. Where does that fit into this picture?
High BMI is currently ranking 4th on the global list, just behind alcohol. But the key thing to know is that it is the fastest rising risk factor of them all.
The rising star in a bad way.
In a very bad way. It hasn't caught up to tobacco yet, but the trajectory is very concerning. Fat tissue isn't just inert storage, it's biologically active.
What does that mean?
It produces hormones like estrogen and insulin, and it generates a state of low-grade chronic inflammation throughout the body. And those excess hormones and inflammation are signals that drive cells to divide, which is the foundation of cancer growth.
And in some places, it's already a bigger problem.
In many high-income regions, obesity is already starting to rival smoking as a leading cause, especially for certain cancers.
Okay, so we have the big 3 plus the challenger: tobacco, infections, alcohol, and BMI. But you said earlier this isn't a uniform picture. And at the top of the show, I teased this gender gap. We have to unpack that now.
It's one of the most striking findings in the entire paper. The researchers found that for men, 45.4% of all new cancer cases were attributable to these modifiable risk factors.
45%. So nearly half of all cancers in men didn't have to happen.
Nearly half. For women, that same figure is 29.7%.
Wow. That is a huge gap. That's almost 16 percentage points.
It is.
So why? Why is the preventable burden so much heavier on men? Is it something biological? Are men just more susceptible to these toxins?
The data suggests it's not really about biological susceptibility. The primary driver is behavioral and environmental. Meaning when you just look at the data, men globally engage in the riskiest behaviors at much higher rates. Men smoke significantly more tobacco than women. Men consume significantly more alcohol.
So just those 2 factors alone
account for a massive portion of that 45% figure. It's the classic vices.
But you also mentioned that occupational bucket of risks earlier. I have a feeling that plays in here too.
It plays a huge role. Men are statistically far, far more likely to work in industries with heavy exposure to carcinogens. Think about mining, construction, manufacturing, firefighting.
So we're talking about things like asbestos, silica dust, diesel fumes.
Exactly. If you look at the data for a cancer like mesothelioma or lung cancers linked to occupational hazards, the patient profile is just overwhelmingly male.
So men are getting hit from 2 sides: internally from lifestyle choices like smoking and drinking, and externally from their work environment.
That's a great summary of it, yes.
So does that mean women are safer? Or is their risk profile just different?
Not safer, just different. While their overall preventable burden is lower, the composition of that risk is unique. For women, the relative impact of infections is much, much higher.
And that's primarily because of cervical cancer, which is driven by HPV.
Yes. Cervical cancer is a massive contributor to the female data set, particularly in low and middle-income countries that don't have widespread screening. And as we mentioned, high BMI also plays a larger relative role for women than it does for men in many parts of the world.
So you have this dynamic where men are battling a kind of smoking work problem, while women are facing more of an infection and metabolic problem.
Broadly speaking, that's a very good way to put it.
Which leads us perfectly into the geography. The study is called a global map, and if you look at the graphics in the paper, it really is this incredible patchwork quilt. The risks are not spread evenly at all.
No, the extremes are just wild. Take East Asia, for example. So China, Japan, Korea.
What's the story there?
East Asia has the highest burden of preventable cancer for men in the entire world. A truly staggering 57.2% of male cancer cases there are preventable.
57%. That's almost 6 out of every 10 cases. That number is just hard to comprehend. What is driving it so high?
It is a perfect storm. You have an extremely high prevalence of smoking among men in that region. It's culturally very ingrained. But then you layer on top of that some of the highest levels of industrial air pollution on the planet.
So their lungs are getting assaulted from the inside by cigarettes and from the outside by smog.
That's it. And the study makes it clear that air pollution isn't some minor irritant. It accounts for a significant portion of lung cancer cases, even in people who have never smoked. But when you combine widespread smoking with that level of pollution, the synergistic effect on the lungs is just devastating.
Now, if we spin the globe over to, say, sub-Saharan Africa, the picture changes completely, I assume.
It's almost the inverse. In much of sub-Saharan Africa, those lifestyle risks we see in wealthier countries, smoking, alcohol, obesity, are still relatively low, but the preventable cancer rate is still very significant.
And the driver there is?
It's infections, the bugs again.
Right.
For women in sub-Saharan Africa, 30.3% of all new cancer cases are driven by infectious agents. That's the highest proportion anywhere in the world. And it just highlights this direct, unavoidable link between public infrastructure and cancer.
That changes the whole definition of prevention, doesn't it? In the West, cancer prevention might look like joining a gym or buying nicotine patches. In sub-Saharan Africa, cancer prevention looks like building a water treatment plant.
That is a profound and critical distinction. The solution depends entirely on where you are standing on that map.
And then there's the one outlier that I always find fascinating: Oceania, Australia, and New Zealand.
Oceania has a completely unique profile. Yes, they have the usual suspects, alcohol, obesity, but they also have the highest rate of cancers caused by ultraviolet radiation in the world, by far.
From the sun.
From the sun. Nearly 10% of their preventable cases are melanomas.
10%? Just from sunlight.
It's a classic case of a mismatch between genetics and environment. You have a population that is predominantly fair-skinned, genetically adapted for the low light of Northern Europe.
Living in a place with some of the most intense UV radiation on Earth.
Exactly. And the result is written in their melanoma rates.
I want to pivot now to a really critical part of our analysis. We've been throwing these numbers around 7.1 million, 40%, as if they're solid facts. But you hinted earlier that this huge study might actually be, well, conservative, that the real numbers could be higher.
I do believe that, and the authors of the study themselves acknowledge this is a real possibility. 7.1 million is very likely the floor, not the ceiling.
Why would it be an undercount? If they looked at 30 different risk factors, what could they possibly be missing?
Well, first, there's just the issue of data quality. In high-income countries, we track everything. We have solid cancer registries, good surveillance. But in many low-income countries, that infrastructure just isn't there.
So cases are missed.
Many cases. If a person in a remote village gets sick and passes away without ever seeing a specialist, they never enter the global data set. We are almost certainly missing a huge portion of the infection-driven cancers in the developing world, simply because they aren't being recorded.
That makes a lot of sense. But you also mentioned a methodological problem you called the independence flaw. Explain that.
It's a kind of statistical necessity that creates a blind spot. The study, for the sake of calculation, looks the risk of each factor independently. So it calculates the cancer risk from smoking. Then separately, it calculates the cancer risk from drinking, and it adds them up.
But in the real world, people aren't just variables in a vacuum. A lot of people smoke and drink.
A lot of people do both. And when you do, the risk isn't additive, it's multiplicative. It multiplies.
How does that work biologically?
Alcohol acts as a solvent. It damages the delicate mucous membranes in your throat and your esophagus. This makes it much easier for the carcinogens from the tobacco smoke to actually penetrate the cells and do their damage.
So the alcohol essentially opens the door and the smoke just walks right in.
That is the perfect analogy. The combination is synergistic. So by treating them as two separate lists, the study likely underestimates the true cumulative danger for the millions of people who have multiple risk factors.
That is a terrifying thought. That if you engage in 2 or 3 of these behaviors, your personal risk is probably much higher than the global average would suggest.
Almost certainly. And finally, we have to revisit that time lag assumption.
The 10-year window.
Right. They use the 10-year lag, which is a standard epidemiological average. But some cancers take 20, 30, even 40 years to develop. Mesothelioma from asbestos exposure is a classic example. It can show up decades after a person leaves that job.
So by only looking back to 2012, they might be missing cancers that were actually set in motion back in the 90s or the early 2000s.
For those very slow-growing cancers, A 10-year window is just too short to capture the full cause and effect relationship. And again, this points to the final numbers being conservative.
So 7.1 million preventable tragedies is the absolute minimum. That's heavy. But let's turn to the implications. We have the map, we have the numbers. What do we do now? Dr. Andre Ilbawi from the WHO, who was a senior author on this study, said something that I think frames this perfectly. He said, this is the first global analysis to show how much cancer risk comes from causes we can prevent.
It's a pivotal statement.
Yeah.
Because it demands a shift in where we put our money and our energy. For the past 50 years, the war on cancer has largely been a war on treatment.
Right. Better chemo, better radiation, immunotherapy.
And all of that research is vital. It saves lives every single day. But what this study argues is that we cannot treat our way out of this problem.
The numbers are just too big.
They're too big. Katie Dane, who is the CEO of the NCD Alliance, she argues this very forcefully. The economic burden of treating cancer is becoming unsustainable for even the wealthiest nations.
So if we just wait for 7.1 million people to get sick every year and then try to fix them with expensive high-tech medicine?
We will bankrupt our healthcare systems. It's that simple. We have to stop the leak, not just keep mopping the floor.
So what are the specific interventions then? If we want to attack those top three, tobacco, infections, and alcohol, what does that look like as policy?
For infections, the path is incredibly clear. Vaccines. The data on cervical cancer is absolute proof that the HPV vaccine is not just an infection prevention tool, it is a cancer prevention tool.
It's a cancer vaccine.
It is a cancer vaccine. Expanding access to it in places like sub-Saharan Africa and Southeast Asia is probably one of the most cost-effective anti-cancer strategies humanity has at its disposal right now.
It's basically a shield against cancer that we already invented.
We did.
Yeah.
And the same logic applies to the hepatitis B vaccine. You prevent the infection, you prevent the liver damage, you prevent the tumor. These are solvable logistics problems.
What about the behavioral factors then? Tobacco and alcohol. Just telling people to stop doesn't work on a mass scale.
No, relying on individual willpower is not a public health strategy. Policy is. We know what works for tobacco because we've seen it work for decades.
Taxation, plain packaging.
Banning advertising, creating smoke-free public spaces. When you make tobacco extensive, inconvenient, and uncool, consumption drops. It's proven.
And the argument is that we need to apply that same thinking to alcohol.
That is the next great frontier. Right now, alcohol is marketed as this aspirational lifestyle product. But when it's causing 3.2% of all cancers, there's a very strong argument for regulating it more like tobacco with better pricing, better labeling.
A cancer warning label on a bottle of wine.
It might not stop everyone, but it would absolutely change the public conversation about risk.
And finally, the environmental piece. Air pollution. You can't just choose not to breathe.
And that's why it's a public health emergency. In places like East Asia and India, transitioning away from fossil fuels isn't just about climate change or, saving the planet in some abstract way. It's about reducing lung cancer rates in their citizens right now.
It connects everything. Climate policy is cancer policy. Sanitation policy is cancer policy.
It truly is. In a developing nation, just providing clean water and cheap antibiotics to treat H. pylori is an incredibly effective cancer prevention strategy.
It demedicalizes the solution.
Exactly. You don't need a billion-dollar oncology wing to prevent stomach cancer. You need clean water and basic primary care.
This has been a huge download of information. We've gone from, DNA damage at the cellular level all the way up to global policy.
It's a complex web, but the main takeaway is surprisingly simple. A huge portion of this disease is within our collective power to control.
So let's bring it back to the listener. We've talked about these huge global stats, but what does this mean for the person listening right now, today?
It's really a call to action on two different levels. The first is personal. Just look at that list of modifiable risks: tobacco, alcohol, diet, sun exposure, vaccines. These are the levers that you personally have some control over.
And it's so important to say that it's rarely too late to make a change.
It is never too late. The body has this amazing capacity to repair itself. If you smoke, quitting starts to reduce your risk almost immediately. If you drink, just cutting back reduces your risk. Wear sunscreen, check if your vaccinations are up to date. These are small actions that compound over time and offer real protection.
And what's the second level?
The systemic. You have to understand that political decisions directly impact your health and your family's health. When a government pushes for cleaner air standards or for regulations on known carcinogens or taxes on sugary drinks, they are literally fighting cancer on your behalf. Support those policies. We have
Yeah.
to create an environment where the healthy choice becomes the easy choice.
I want to leave everyone with one final thought to reflect on. We threw a lot of percentages around today, 40%, 15%, but just think for a second about what that 40% really means.
Hmm.
It means that almost half of the oncology wards in the world are full of people who didn't have to be there. It means millions of families go through the absolute tragedy of a diagnosis, of treatment, for reasons that were not inevitable.
That is the tragedy, but it's also the opportunity.
The science is there. We know what causes a huge chunk of these cancers. The gap now isn't really in our knowledge, it's in our behavior, and it's in our policy. So the question I want to leave you with is this. What would our world look like if we treated air pollution, or alcohol marketing, or sugar intake with the same urgency we treat a new viral outbreak?
That is the question we all need to be asking.
How many of those 7.1 million people would still be with their families today? Thanks for diving deep with us. It's a heavy topic, but hopefully armed with this data, we can all make better choices for ourselves and for our world.
Absolutely. Knowledge is the first step.
Catch you on the next deep dive. Stay curious and stay healthy.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.